Today, we have another case of Dr. Sneha Barsainya, whereby she is presenting her experience of learning when she was intern. As an intern, we come across various situations, isn't it? So many times patients don't respond, they don't talk, they consider us junior, or there may be various situations. What happened to Dr. Sneha? Case has been already sent to you. Now let us listen story from her own words. She will share her screen and then we'll have story from your side. At the same time, she expects to have response from you. Let us have it interactive session, one more learning session for our development and our growth. Thank you.
Start now.
स्लाइड कहाँ पे?
स्लाइड वो लैपटॉप
इसमें लिया ना अभी
वो
WhatsApp
व्हाट्सएप पे
It's okay. You can put on your mobile and you can read from that PDF file.
Good evening, everyone. I'm sharing my experience as an intern of a case around 14 years back. So, I would just want everyone to recollect when our internship is going on. We are definitely working or learning. We are always in a learning process under our senior doctors, sirs. So we come across various kinds of patients. Those who are very anxious, those who are calm, those who are agitated. So this case, when I was taking, just keep in mind three situations. I was alone with a female dispenser. The second thing, sir was coming late to the clinic. And the third thing is the patient was there, he was very, very anxious and irritable when he was brought to the clinic. So you just keep these three things in mind, and where I have to integrate the data and I have to present it to sir, get the totality vis-a-vis, I have to handle the patient also who is outside. So this also the story is a plight of an intern, like what all experience I go through and what changes and brought in me and how it helped me for the practice. So hereby I will just share my experience, and I still remember this very fresh in my memory. And I also learned about lot about myself, like in which situation I can handle, how I can, what situation can make me anxious, what situation can make me perturbed, disturbed, and vis-a-vis stabilizing that and attending to the patient, and how the fundamental principles of homeopathy, our aphorisms, help us to keep ourselves balanced in sound senses and calm, so that we don't forget our mission. Okay, aphorism number one. So these things came, I really lived in. I got a very live experience for me. Now, this was a situation at the clinic. I was alone with a female dispenser, and sir was yet to come. And I had just finished a follow-up, and I got a call from the patient's mother. She was our old patient, existing patient. So what the mother said on the phone was really it really kept me on my toes. So just follow. The first thing, that my son was suffering from boil, which was painful since 3 to 4 days. She rather warned me, means her tone, and was so much desperation. Can you do something about it? Because the desperation, ki son will not wait for a long time, and as he was having an exam tomorrow. So there was also a time limitation within which I had to complete the case, analyze the data, present it to sir, and then prescribe. And she also inquired whether the main doctor is there or not. So see, as an intern, I think all the interns can relate to me now when patients are there, and such kind of patients who are always inquiring about the main doctor. So what kind of mental state we are in, what kind of anxiety we go through, how will be able to attend the patient. Patient is constantly asking whether the main doctor is there, not there, and in his absence, how you as a junior doctor can manage the situation. So this was the telephone. Already the mother had given me certain hints. So I assured her that sir will, actually I informed her that sir will be late, but still get the son to the clinic. I will take the necessary detail, consult over phone, and the process will not take much. I have to assure her many things. One thing, how will I manage? How will the son get the medicine? And within a short span of time, so that he also doesn't get late for his preparation. So she agreed to come with the son in 10-15 minutes. So now is entry to the clinic. I still remembered I had already informed the pharmacist that this patient would be in a hurry. So as soon as he comes, please send him to the cabin fast. So this was a preparation from my side. And when he came, He was a young boy of 21 years. He just chopped into the cabin and said in a very irritated tone, now just mark it, how was his tone, that we'll wait for only 5-10 minutes and I leave as I have to prepare for exam. So he was very clear. In 2 sentences, he made his impatience very clear. We'll wait only for 5-10 minutes and I leave as I have to prepare for exam. So he has already time bounded me. A mother also requested, means the request or the pressure was coming from both the sides, because the mother was an old patient, so we knew that for data for giving medicines or giving for prescribing a remedy, we do ask questions, we take a detailed case. So she said that please don't ask many questions and give medicine in 5 minutes. So imagine in 5 minutes I have to receive the case, I have to analyze, talk to sir. So that's not possible, right? So I was very anxious because I had to handle the patient outside. I had to take the data, plus I had to make the prescription. But I had no choice, but I had to control my anxiety. I was just an intern, very just passed out 4th year BHMS, I think 2nd or the 3rd month of my internship. So itna time frame mein data kaise lena, how am I supposed to handle the patient's anxiety, the mother's anxiety, or utna hi precisely data sir ko dena was a huge task for me. And sir was also not there. He was to come late. And the patient wanted things to happen very fast, just say 5 to 10 minutes. And Dr. Mehta, sir would demand all the details. कैसा था, ODP क्या है, characteristic क्या है. अगर कम data होगा तो I will not be able to. Yeah. Huh. And first was to take the old, but it was clear in mind, and this is how I began. First, I have to take the ODP. So I started asking I started asking all the ODP and thought to go for the modality, the way we usually go. Now the chief complaint, no history of fever. It is a left mandibular area. There is a boil. Abscess was very small in size with no pain, but since last 2 months, it was a continuous pricking type of pain, which was aggravated touch 3 marks, movement 3 marks, and also some thick whitish, occasionally blood stain discharge started from today. And then again, in the midst of the situation, when I was answering, with giving this data, it only took me 2-3 minutes, and he was saying that doctor, I'm leaving, I'm going to the allopathic doctor. So can you help me what I should be doing in this situation? Can the interns help me, like what I can do in this, like within 2-3 months, the patient is already telling you that I'll be going to an allopathic doctor. So there was a desperation that, oh, I need to hold him before he slips, because his patience was really fast, and already the threat which was coming made me more anxious that what if he leaves the clinic, because there are all allopathic doctors. He had a family physician, so it's very easy for him to go. Why he need to face so many questions and answers? The allopathic physician can prescribe very easily, seeing the abscess. I was terribly anxious. I got too terrified and I had actually too much to handle. Sir was not there. And what if patient goes away? So naturally sir will ask me, na, kya hua? Why, what answer will I give to him? Why you were not able to handle the patient? So all these 3 things combined with patient really put me on a very difficult situation. So how did I attempt it? I just told him that, yes, I've understood your problem, but just cooperate for few minutes and then you leave. I was pleading to the patient that just I was begging time for him that just tell me your problem, how it is bothering you. So at least in the hope that I'll get some data from there. And thank God, I felt a little, whatever he gives, take it, record it in patient's own word. It's better. It is better than allowing the patient to go from the clinic. So whatever little you get, I would be very, at that time, I would have felt like it's, ठीक है, इतना भी मिला तो भी बहुत है. And then patient calmed down and he agreed to answer a bit of my questions. He said that it is I just asked him how the boil is doing. It is saying that it is affecting my concentration. I'm unable to study since 2 days. My exams are coming up. I did not get time to study. So studying, and he was studying at the last moment. If the infection increases, I will have more problems. Then I asked him, what kind of problems will you have? So he said that I'll not be able to concentrate on studies. It also affects my looks. It looks bad. That is not decent. I cannot have a normal shaving. And it is something odd, not normal. That was his state. And it is irritating him. But risk of there was a risk, but try to make the maximum use of the symptoms I had with me, whatever I had. I knew I had very little time. Like he was almost, I still remember the dispenser she kept coming in and telling him that patient is getting very anxious. He's shouting on mother that please hurry up. So the dispenser, he made the dispenser also very anxious. And in turn, she kept storming into my cabin. So now I said कि चलो अभी rapid fire round करते हैं, फटाफट data लेके, at least वो patient को assure करते हैं I've understood. So I asked him, only one question was bothering me, that since you have the problem for 2-3, why you have come today? You could have come 2 to 3 days back. So what made you come today? So he said that initially it was just a boil, so he neglected it. He did not pay much attention to it. Now since my wound is open and generally I travel by bike, so if by chance the dust settles in, I will catch an infection and hence I came for treatment. So this was the motivating factor why he came for the treatment. Because he had some fear कि कुछ bad हो जाएगा, infection हो जाएगा, मेरा look खराब हो जाएगा. And then the patient in turn said that doctor, you are just bothering me now. बहुत हो गया, अभी और questions मत पूछो. I cannot answer, I have to go away. I have to go home and study. You're consuming a lot of my time. I just want to get out of here. The pain was also bothering me too much and I cannot sleep properly. And then just quickly some few questions on thermals and modalities. And these were the deviations which I got from the normal. One was a thermal reaction. The patient was not able to tolerate the AC and he had to take blanket and bath with warm water. Craving he developed in the recent time during 1 week was spicy, 3 marks. And the physical examination, temperature was not there, pulse was 80, BP was normal. Local size mein mark was tenderness, red and warm. And it was just 3 by 2 centimeters also, very small. But it was so much bothering to the patient also and to the physician also. So at last I told him, I assured him that chalo jitna hai, little was also enough. Just wait for 5 minutes for the medicine. I'll prepare and you will be able to go. And yet I have not broken my fastest record. It was the fastest case which I had taken. Now was the task. I had called up sir and briefed him about the situation and said, the data is not enough for, I knew कि sir will shout why you didn't take the data properly. So when before only I told him that this was the situation, ऐसा हुआ था. I don't have whatever I have, I'm telling you. Now it was aphorism number 84 implementation. Quickly sir had asked me, because since I had written down whatever the patient had said from words to words, so I could tell him. So sir asked me, so okay. So how far can anyone share their experience in past, or as in this situation, how would you all handle the patient? I would like to know from the interns, especially, or from anyone, from all the doctors. Can you help me in that? Like, this is a situation where patient is not allowing you to, not cooperating, not giving you data, always saying, I'll go to the allopathic physician twice, thrice, with people storming into the cabin. So can anyone help me? As to how would you all go about dealing with the patient in such situations?
Hello.
Hello?
Yes, Dr. Sneha.
Yes.
Yes, I am Dr. Lanke Pramod.
Yeah.
It is a very difficult situation,
Yes.
as you told the case,
Mhm.
because patient is in very hurry and he is very impatient.
Mhm.
So many times the patient which are not cooperating, we must have to handle such situations by the observations and how the patient is behaving in the clinic. That is so important. So this is one strategy to observe the patient. And another thing, actually, you are saying that this is very difficult situation. So newly physician who is coming in the practice, and they are uh, quite mm, quite in the bad situation to handle such cases. So it is better that you go through the case and how you handle the case, that we have to know.
But actually, I would like to know from the other students, the interns,
Yes,
like how
yes,
they
yes.
will handle this situation. Like, I want
Yes,
to
yes,
know about, help me out.
yes, yes.
How would you handle the situation that the patient is not cooperating, your senior is away,
Hmm.
and all the sirs and all, they like the data to be present to them in certain manner for prescribing. And the patient is at the most on the verge of leaving the clinic. The dispenser came at least 2 to 3 times inside.
Yes.
So anyone in the group can help me out with the situation?
Kinjal, are you there? This is something we come across in the OPD so many times, that patients do not respond, isn't it? And considering interns or students as a junior, they just want to talk only to the physician on the chair. I'm sure you must have come across such a situation, Kinjal. Right. Anybody else who has faced such situation, if during any time of their training or internship? Maybe we all are practitioner today, but any such situation has come up?
I try to take it during the physical examination because that is very important for them.
Yeah, tell again what you want to say, Dr. Manali.
I try to take the data during the physical examination. I purposefully delay the physical examination. I go more in depth. I should look for the physicals. BP में time डालूंगी ये करूंगी.
Okay, so there is one technique that you can do, engage patient, and then you buy some time and you talk to the patient. That is what you mean, right? The patient feels that you are having the concern and now you are sparing time for examination. Is you have concern for the problems and not just talking and chit-chatting, wasting time. Okay, there is one technique. Anything else?
Another technique. Can I talk, sir?
Yes, Dr. Lanke.
Yeah. Another technique that if the patient is having a local pain or local affection in the physical body, so we can uh, go and to touch the affected part. If he is having a much pain, he would not allow to touch the painful part. That is one from which we can collect the another symptom, and we can feel how patient is very anxious for the pain condition. That means we can find the local modalities from his physical affection.
Dr. Pramod,
Yes, sir.
what is the situation of the intern, the physician who was attending the patient? What was her situation? She has very well vividly talked about that. So in that state of mind,
Yes,
what is
definitely.
best that she can do? So how to deal with
the-
such situation?
uh, Another thing is best to sit on the chair quietly and observe the patient what he is doing and and how he is behaving. So
But so by the time you just observe the patient, he will be gone in
no,
2 minutes.
it's not. It's not. I'm not talking about that, but it's better to observe his behavior, how he's how he's very anxious or irritable, or is he really in the horrible situation due to the pain, or he is anxious about something else which is bothering to him. Okay, that means if he's in hurry, as Dr. Sneha is saying that the patient's mother is saying that we have not much time and he is bothering about his exams and he wants to go immediately. He doesn't want to stay there for your question and answers, and he wants to go for the studying to prepare his exam in the next day. So that would be the remarkable things, that even the patient is also showing his irritability and anxiousness and even the impatience in the case. So these are the observational things. We can see that anyone means interns may not be having too much experience to see inside or in situ. So I could not. I'm giving such technique, or I am giving such things that would help to observe the patient. Yes, sir. Go further, sir.
So see, the point is that when we want to take a case in the care of the physician, there are certain things that is required. Then only we can act as a physician. And foremost thing is having a sound sense. The sound senses that help us to perform as a physician,
Yeah.
help us to make judgment, help us
Yes.
to observe as it is. But now here, the physician has very much clearly stated how she was clouded, how she was in so much of the anxiety, by herself restlessness, by herself in the irritation, because she was constantly poked to behave or act in a particular manner. And constantly she is telling one thing that Dr. Mehta is not there. I have to do, I have to answer, I have to perform. So there are both the sides. Now she is sandwiched. She feels
Yeah.
sandwiched. One
Yes.
side is a patient and mother, and the other side, Dr. Mehta, and moreover there, it is a club sandwich. Moreover, there is a dispenser who is coming and disturbing so many times.
Yeah.
So this is something very interesting that Dr. Sneha, now if you share your experience that what helped you to deal with this situation and perform further. Because one thing we can definitely say that she succeeded in getting certain data.
Yes.
At the she could get origin, duration, progress. That is a morbid phenomenon. She could also note down what is bothering to the patient. She could note down the and as pen down things in a very systematic manner.
Yeah.
So, Dr. Sneha, are you there? Hello, Dr. Sneha. Hello, Dr. Urmi, you want to say something?
No, not really, but I think, this should be the first lesson for really to handle the OPD, to calmness and confidence. That really helps actually, because this situation, even I have an assistant of not 8 years, so we patient आके बोलते बड़ी मैडम कहाँ है, we won't show you. And in beginning में she used to feel stress. I said, okay, you tell, if you want, you can wait for some time. But of course, at this stage, we can afford that. Okay, we know that certain it's your choice. But in the for interns, I think they should learn how they handle, because all doctors in general OPDs, they don't really let go the patient. So this should be a, since you are a so far professor in institute, so I hope कि अभी जो है patients, suddenly the things have changed over when we were students. तो भी हमको respect मिलता था. Nowadays patients don't even respect consultants also. So I think all coming new interns and doctors should be taught that calmness and confidence is the first. A prescription may vary a bit from person to person. That's what I wanted to say. Thank you.
Thank you, Dr. Urmi. Before we just proceed, there is a small request to Dr. Pramod and Dr. Ajay to mute their microphones.
Okay.
Okay, thank you. Whenever you want to say, you are welcome to say, but after you have contributed or shared your views, please mute your microphones. Okay. And you please switch off your camera also. Okay. So Dr. Pramod, please switch off your camera, video camera. Okay. Thank you, Dr. Pramod. So you now.
May I contribute something?
Yeah, Dr. Sonil, sure, welcome.
Yeah. Now, the state of patient was kind of agitation, kind of anxiety, kind of rush, and kind of intimidating to the young physician. What I have found very useful in such situation is to apply our concept of homeopathy and vibrate with the patient in his own words. Like I would have said, oh, tamne bahut jaldi che, like, are you in real good hurry? It seems yes. And there is exam, so you must be quite tensed up. And you would like to finish off all this very early. By saying these words, I think that really calms down most of the patients. Whenever they have their problems, I repeat their problems in a little louder and little intense manner, and which allows the patient to understand that we have followed their feelings, or we have understood their feelings, or we are able to understand the hurry or the agitation within them, and that itself calms them down. And then we can take our time to complete our formalities. But I think first thing is to acknowledge their anger or their pain or their hurry or their anxiety. I think that really works in a clinical setup. Dr. Kamlesh, your mic is muted.
Oh, thanks for telling. I'll contribute again. That this is a good point from Dr. Saunil, that the moment we express our concern to the patient that yes, I have understood your problem, I am vibrating with your frequency, I am with you, and I will also make a point that at the earliest, the way you want, we will complete the data. But if a patient finds a physician point up or anxious or restless or irritated or impatient or in whatever state of the mind that makes physician uneasy, then obviously that will aggravate the patient's state. At the same time, his confidence level will also go down. Now here patient is showing almost is challenging the capacity of the physician, whether you will be able to do it, because he has been prone to go to allopathic doctors, and allopathic doctors obviously will not waste single moment for prescription, just has to have a look to the boil and write down best of anti-inflammatory painkillers and antibiotics. That's all. At the most, he may do little dressing to help the patient. So his actions are very key. If he's used to do that, obviously he's going to demand 5 minutes remedial measures from doctor. So these two things doctor require to balance self as well as understanding of the patient, what patient is trying to convey. Good point from Dr. Sonil. Thank you very much. So now we are taking up the charge of a consultant. That as a consultant, we have to take care of a patient. At the same time, we have to take care of that intern who is already hurt up, who is already in the distress. Patient is in distress, doctor is in distress, and as a consultant, you have to take quick decision, especially when you are not in the clinic, but on the phone. All this data is conveyed to you, and you have to proceed further. So now let us see how Dr. Sneha managed herself, and then we as a role, in the role of consultant, how do we proceed and go ahead in making the decision. So is group ready for that?
Yes, sir.
Hello?
Yes, sir.
Okay. So Dr. Sneha, please go ahead. Dr. Sneha, are you there?
Dr. Sneha's mic is unmute, sir.
Hello. Just a moment. She's unable to share her. Dr. Pankaj, can you make Dr. Sneha to share her screen? Dr. Pankaj, are you there?
Yes, sir.
Dr. Sneha requires permission to share screen.
Sir, just a minute. सर स्नेहा जी का नाम क्या रखा उन्होंने अभी दिखाई नहीं दे
It is me only, Kamlesh Mehta. I am on 2 screens.
Yes, sir. Can share now. Sneha ji, please try again.
Okay. Okay. Am I audible? Am I audible?
Yes, yes.
Okay.
Yes, you
So,
are.
sir,
Please continue. Please continue.
okay. Okay. So, quickly, sir had asked me to explain the patient's case in his own words. So, this is what the patient said about his complaints, and mark these are the patient's original words. And the recording became easy because I had followed the instructions. So, I could say each line word by word as to what exactly the patient said and my observation about his state. And it was reflecting my state too. As you can see how anxious I was triple anxious before presenting to sir at that time. So in between, the dispenser kept on alarming me that they wanted to leave. So now actually I had lost my patience also. It was very irritating and very frustrating as to who requires what is happening, why the patient is making me so restless and so in a hurry state. At least let me do my work. So again, the mother came and said, will you please hurry up? If you cannot do it, then we can go to some other doctor. As if, they were trying to inbuild, as if, I got a sense that they are doubting my capacity. They are suspicious that I'll be able to treat or not. Because the same doctor can do in 2 minutes, why you as a doctor taking so long? That was very, very much evident. And otherwise, the problem was that the son kept on shouting at his mother, and the mother started getting restless, and then she started putting. So it was, chain reaction. So my observation constantly hurrying up mother. If the medicine is not delivered fast, we'll go to the allopathic physician. So this was his state. He kept on informing us. So this really annoyed me, and I was internally very stressed out as to how to balance, what to do in this condition. Then the integration came. While talking to Dr. Mehta, I started integrating my data, whatever I had got. Data, the observation, and my experience. So these three collectively, the integration was going on in my mind. And then I got some insight of the case. So this is how I balance myself, like going to the basics of recording the aphorism number 84. There you have to record the exactly in the patient's language. You have to observe as to how is he behaving outside and with his family members, and incorporate your experience. That is your observations. So this is how I was able to do it in the form of description. Now this was a description given, which was a young boy of 21 who just stormed, and he said in a very irritating tone, he was only ready to wait for 5 to 10 minutes and leave, as I have to prepare for the exams. The third thing, doctor, I'm leaving to the allopathic doctor. So these three were the characteristics which was there, which was very much evident.
Dr. Sneha, hold on. So what is the symptom from these three situations? What symptom do we make?
Impatient.
Yes. See, these are the workshops, web workshops. So we have to be actively participating. It is not something for the presentation. We have to experience, learn, and evolve together. What is the symptom that we can make out?
Restlessness.
Very good. Yes.
Anxiety for the exams.
Yes.
And
anxiety, restlessness. What else?
carried desire fast.
Carry
He
desire
wants to
fast
be
is
treated very fast. Like he wants to be treated very fast
yes,
by
he
the
wants to be
doctor.
treated very fast.
By the
Restlessness
doctor.
and anxiety, yes. Very good. Any other contribution? Any other symptoms?
Impatience.
Impatience, yes. So, Dr. Sonil, how do we differentiate impatient from restlessness?
Restlessness, you will be able to observe in form of the movement, lack of attention, and changing from here to there. While impatience, he is putting it in clear words that please hurry up, I'm in a hurry, I want to do this, I don't want to waste time. That itself shows a lack of ability to understand other persons or opposite person's situation and demanding something very fast. While restlessness is not related to outside, it is within themselves that they are restless.
Okay, so now we have three states. That is what you brought out. One is restlessness, another is impatience, and third is hurried. Because we have three different indexing in the repertory. So how do we differentiate hurried from impatience?
Hurry is something which I do for myself. When I want to do something, I do it fast, without no proper care or maybe making some more silly mistakes. That is hurry.
Okay.
While restlessness is I'm not able to settle down and focus on the task at hand.
And impatience?
Impatience is something which I demand. I cannot understand the other person's position, and then I demand other person to hurry up.
Yeah, Dr. Sonil, thank you very much. Anybody else who can differentiate restlessness, impatience, and hurried? Dr. Sonil has put forward his ideas very, very, very clearly. So now how do we see these three states?
Sir, hurried is action and restlessness is a behavior. And impatience is a emotional state of the person. Like once his impatience becomes a base and the hurried is a action. You can see the patient's actions, doing very
Okay. So you mean that impatience make person hurried?
yeah. And
Okay.
it can be expressed in the form of a restlessness. That is a behavior. The person either keeps on changing the position or keeps on changing the activity.
Okay. Yeah, thank you very much. Who else? बहुत अच्छे जा रहे हैं हम. We are discussing it very well. Okay, Dr. Sneha, how would you differentiate these three? Okay, Dr. Pramod, before Dr. Sneha. Dr. Pramod, yes.
Okay.
Switch on your mic, Dr. Pramod.
Impatience is the situation in the patient that he is showing the lack of patience or the tolerance. Okay, so we can say that it is a restlessly eager thing. Eagerly, he wants to understand everything, which is eager. So in his behavior, we can see that he is very impatient. So according to my understanding, the person who cannot much tolerant about his work or anything which is he is doing his job and all these things. So it is a impatient thing. So and restlessness is maybe connected to his physical problems, or maybe attached to his emotional problems also, or we can say that emotional pathology. So restlessness and impatience, they all are both the things are very discriminated.
The restlessness is not connected with the hurriedness or impatience. Restlessness is the behavior of the person. No, you can see the person keeps on changing the activity or keeps on moving or like that. And it may patient may not be hurriedly wants to do the thing fast, or he may not be impatient. The restlessness is different from the impatience and hurriedness. But hurriedness and impatience have got some connections. Like
No, I'm talking about that restlessness. Hello, sir. Can you hear me?
Yeah, go ahead.
Yeah. Restlessness is the thing which is coming out of his anxiety or the boredom. Okay. So it may offering on the physical or the emotional level. So involving the constant activities. That's why we can say that this restlessness is connected to the physical or emotional pathology. But impatience is a different thing. That what I said before.
Can I contribute?
Yeah.
Yes.
If we look at the word itself gives a meaning. Restlessness means whereby you don't want to remain in the state of rest. You want to be active, you want to do something, be it mentally or be it physically. If you go for impatience, it is lack of patience.
Yeah.
You cannot tolerate. There the issue comes with the tolerance. But in hurry, you want to do things quickly or you want to do things hastily. So
Yes.
and a hurried person need not be impatient.
Yeah.
A hurried person just wants things to be very quick. That does,
Yeah.
but he need not be impatient.
Yeah.
His
Maybe.
issue is not that I can't wait for the thing. I just want my things to be fast.
Yes, definitely.
Dr. Manali well said. Only little point is that nobody wants to be restless. Nobody wants to be without rest. You said restlessness is the one who wants to be without rest. Okay, that may be little mispresentation. That's all right. So restless. This means one who is without rest. What is rest? Rest is where activity is lacking. So these are two negative things. It means one who is restless, we find active, maybe unnecessarily active, overactive. So that is why we see that how Dr. Jagruti has insisted again and again that it is the behavior. So it seems in the action of the person. But we also need to understand that there is a mental restlessness and physical restlessness. There are two different kinds of restlessness observed in our Materia Medica. And restlessness and mental restlessness is person is not at the rest mentally. So person is not at peace. Person is quite disturbed without any rest. Physically or mentally, it may be coming up in the way of the behavior. It may not come in the way of behavior. But the state is important. Person says, I don't feel at rest. I don't feel at peace. The same way, impatient is where there is a lack of patience. So when there is a lack of patience, what is the state? The state is of annoyance and irritation, frustration, because the situation is not accepted by the person. The way the situation has to go, it is not going in that fashion, but I want it to be differently. And my annoyance is because of the delay. The delay is not accepted by me. So that causes impatience. Is these 2 points clear? Without rest, without having peace, without that is restless. Whereas annoyance or irritation as a result of the delay which is occurring, which is non-accepted by the person, that state is producing impatience. So in impatience, there is a state of irritation, annoyance, non-acceptance, the way things are going on. Whereas in hurried may be also in the expression. We can say, oh, you seem to be in much hurry. It means in whatever way the normally we do the activity, it is not done in that speed, but little in a higher speed. So the person who is hurried, he is rather at the different speed, which is not normal, or he may want other to do the task at the higher speed. That is why we say, come on, come on, come on, hurry up, hurry up, hurry up, hurry up. Your time is going on, time is going on. Now, before when exam is going to get over, there are just 5 minutes, 2 minutes remaining. Then that is what comes up from the inner voice, or the examiner says, okay, come on, come on, come on. Supervisor says, come on, hurry up, tie up your supplements. Means don't do at your own leisure or at your own activity, but you do it little at speed. These are the 3 different things. Without rest, without delay, and faster than the usual. And without delay is with the irritation and annoyance. Does that make 3 things clear?
Yes, sir.
Yes, sir.
So this patient is what? Restless, impatient, or hurried? The description is right in front of us.
Impatient.
It is impatient, right? Because there is irritation. And the point is that, yes, Ayushi, impatient, because patient wants things to happen in the delay he is not able to tolerate. That is making him irritated, annoying. That is why he wants things to be faster. And that is expressed in the form of, that is taking away, impatience is taking away his rest. So what is the central issue is impatience, which is expressed in the form of restlessness or wanting things to be in hurried. So is this point clear about the symptom?
Yes, sir.
Okay, so this symptom analysis, if we do, how is it? From Hahnemannian classification of symptoms, is it characteristic or common? If it is characteristic, then is it peculiar, uncommon, singular, or striking? Dr. Sneha has already showed the analysis.
Sorry.
It is a disposition, is a tendency, because it is coming up throughout the interview. At every different instances, he has showed the same tendency, and is striking that if you are going to a doctor, if you are seeking advice, you are seeking help, but you behave like this. So that is something very striking, very much alarming to the physician, that okay, so this comes under characteristic disposition due to striking behavior. So what can be the rubrics?
Sir, carry desire fast can come.
Okay, carry desire fast, and any other?
Anxiety about exams.
Okay, but here when you convert it into symptom, you have not taken the anxiety. You have taken impatience. Impatience is a rubric by itself, right?
Okay, rubric can be taken.
So impatience, but what qualifies impatience is desire to be carried fast. Are you getting this point?
Yes, sir.
So impatience is a very general state, but it is defined further. Okay, so what are the other symptoms we can take up? Dr. Sneha, can you just help us further?
Yeah. So it was impatience. The rubric was taken and, as rightly pointed out, carried desire to be fast. So what were the other symptoms that were coming up in the case?
Okay, this is one analysis given by Dr. Sneha. Do we agree or we have something different to say about it? How much time is left? I am unable to see the watch.
It's 11.
It is 11. Okay, so Dr. Sneha, can you share your experience, how you analyze the case and what was the description? The
Yeah.
remedy, what is the remedy the group is suggesting? Because the case is right out in front of us, we are just taking the steps. Hahnemannian steps. Huh?
Belladonna.
Yes, belladonna. What else? Any other remedy?
Arsenic album, sir.
Yes, arsenic alb. Any other suggestion?
I wanted to add up, sir, this sensitivity to alternating with indifference.
Okay.
That was because initially he was not much bothered about this pain. Later on, the pain increased, and then he became very upset about it.
So, what reference will you take for that?
In the synthesis, there is one rubric is a sensitive alternating with indifference. Belladonna is one drop.
Okay, you are supporting belladonna or you are supporting the rubric?
Supporting the rubric.
Or you are supporting the patient?
I just gave you the reference for belladonna.
No, that is excellent,
reference.
excellent. So now let us check. Is it indifference alternating with sensitivity in this case? The state of the patient, what we have defined, do we find patient is sensitive or we have defined it patient as an impatient? Sensitivity is coming where? About the touch. About the touch. Movement.
Pain also.
Pain. So is it a regular course of the pathology? Is it a course of pathology? Abscess, especially on the jawline, is which is suppurated. Yes. Ayushi says yes. Yes, Dr. Pramod, I will come to you over the remedy. Let us deal with this anxiety, sensitivity with indifference. So is it at one point of time patient is indifferent and now the patient has become so sensitive? Is it focusing the central idea as a sensitivity or a focus idea as a annoyance, hurry, to do things fast, worried about to cope up with the time and about his looks? Dr. Jagruti,
Yes,
are you getting
Is
my
it
point?
the infection?
Sir, he is not talking about, oh, it is so painful. He is not coming with that sensitivity. He is coming with the different zone of the expression. So that is why, if you want to take, you can take the rubric, but you have to see the credit of that rubric in the case. So you think for a while and then even if you want to continue, you can tell that. Dr. Pramod, what do you want to say? Because we don't have much of the time and we want to take best from Dr. Sneha. Okay, Dr. Pramod?
Yes, sir. it is the combination of in general a patient's makeup and his behavior and his mental status and his emotional, as well as the sensitivity to the pain. But I realized when she is giving the case that the person is not much bothering about the pain, but his impatience is looking in the first look, and he is bothering about his look, and he does not want to show his bad look to the public. So it is in general makeup that his emotional and mental makeup is like that, but he is not bothering about the pain as much we see in this case.
See, Dr. Pramod,
Hmm.
Dr. Jagruti has made a very valid point that he's sensitive. He's sensitive about his looks. He's not sensitive much about his pain.
Yes, sir.
So his sensitivity cannot be denied, but sensitivity is not coming up as a central issue, the core of the case. Dr. Jagruti, what do you say?
Yes. The irritability and all comes up as a more specificity of the sensitivity.
Yes, so sensitivity, we can't rule out sensitivity because he's sensitive to touch. He's reacting to the situation. Sensitivity is there. But what is its expression, and how is it characterizing the disposition of the patient? Is it coming up as the central issue of the patient, where he is talking only of the sensitivity, the way your belladonna will put it across?
So you should specify it more further.
We should.
Yeah.
Okay, you should, but you are a consultant, you are aware, and you have to work with whatever data is available. So you give a instruction to the physician to define sensitivity from a patient who is just kept one leg outside the clinic and has been held in the clinic by force. Let us see how Dr. Sneha has done it. Okay, Dr. Sneha, just go ahead.
Okay. See, there was one thing which was this thing I constantly was saying to the mother, I want to get out from here. I want to get out from here. So I was wondering, this abscess which is only 2 to 3, how it can make a person, what is we are doing to the patient that is making us, he could not even go through the entire process of the case taking. So I had thought that I just want to get out of here, and that was coming up in all instant, like right from stepping into the clinic to the between and going out. And it kept bothering him because he wanted to go study for the exam, go to sleep. So one thing I was saying, the symptom I conveyed that he wants everything very fast, very quick medicines and get rid of the pain. So there was an escape which was coming. So he just wanted to escape from the entire situation, from the pain and all. And hence I had to take up the
Dr. Jagruti rightly said, pain is the issue because that is taking away his concentration. But that has just emerged. Now we are focusing to the disposition which is running through and through. And pain has come as just one of the issues that why he wants a treatment. It's not to come up as a main issue. Oh, this pain, you just help me for the pain and so that I can work and I can concentrate. His focus was mainly that, can you get me rid of this sepsis, the problem, so that I can concentrate, I can work, my look is resolved, my everything that is centralizing to that particular point, not only one point of pain. Pain is part of the entire picture. Okay, what else, Dr. Sneha? Go ahead.
Yeah. So in that, if you would have called, then it was one thing that he has said that when I asked him that what brought you here today, that you were suffering from 2 to 3 days or a week. Why you came today only? Because I think the abscess had opened up and he had a fear that he will catch an infection. As he's riding on a bike, the wound will be open. So infection is something bad or something unfortunate thing. And this was a main, in fact, was one of the main of the driving force which brought the patient, because it was a fear. It was not just an abscess of the pain, it was a fear that something wrong will happen to him. So I took as fear that infection which is bad or something unfortunate thing will happen. And it was just a wound. तो उसके लिए वो इतना क्यों परेशान हो रहा था? Like it was something very unworthy. So I took the rubric as fear of misfortune and vanity and desire spicy. Now you know that this was a deviation which had happened from the acute, in the acute state, from the normal. So I took this as one rubric. Okay, so the totality which went was a patient 22 years with so much of inpatient, and the mother was pleading with the doctor to hurry up and not allowing the doctor to take the data. Wanted quick medicine as the pain was causing irritability to an extent he started shouting. So this was his constant behavior, which was associated with the fear. So it had anxiety, it had the pain, and it was associated with fear. That something something bad could have happened to him. And constant threatening to leave the clinic. Like it was threatened. I now when analyzing, I took it as a threatening. He was not actually threatening. He was only saying that if you do, आप करो, नहीं तो मैं और किसी के पास जाता हूँ. To leave, as he could not be in the pay, as he was in could not bear the place. He was under the pressure which was not allowing him to concentrate. And in the clinic also, there was a multiple attempts to escape, either through the mother, either through the physician, and that too he could not even write in the 2-3 minutes of the case taking. And recent cravings which had developed were craving for spicy and thermal disposition. He was chilly. So this was a process of repertorization. In the next 10 minutes, the medicine was prepared and dispensed. The medicine which was the medicine which was
medicine that was prescribed was arsenic alb.
Medicine prescribed that was arsenic alb 200 TDS, 1 powder followed by SL. Follow-up, he came immediately to next to the clinic. I had briefed sir, and sir immediately left his chair and went to see the patient. That was the effect that he had created on sir. I told him, sir, ye patient baithne, and I was also fearing what would have happened. Like, if it's not, if he's
Sneha,
not better, I don't.
Dr. Sneha,
Yes.
how did
yes,
you differentiate belladonna in the case?
So belladonna has a main person is very mad and frenzy with the pain, with so much of impatience was the basic this thing. Because belladonna is more into the delirium state and more of irritability which comes up. And this patient had a lot of fear, had a lot of impatience with impatience coupled with fear, which is not seen that much in belladonna.
See, what he presented, Dr. Sneha, was cautiousness. That this, whatever is abscess, this should not create any further problem at the level of the look, at the level of looks, at the level of his performance in the exam and his suffering. So there was a cautiousness that was seen, and this particular aspect of cautiousness is not much marked in belladonna. Rather, belladonna we find kind of frivolousness, heedlessness. And here, this particular aspect, that was one thing. Another aspect was the vanity, his worry about his looks and his worry about the ugliness that would come up, which is again not within the curability of the belladonna. The point is that for a young person, it bound to affect if something will leave the mark or add to the ugliness looks of the patient. So what is characteristic about it? Characteristic about it was that when it came to that level, that now it is likely to affect his looks, that really disturbed and made him to run to doctor. Otherwise, till that time it was all okay. So that is why that makes it little characteristic. We have to see something which is out of proportion, something which is intense, something which is unexpected. Then it becomes characteristic because it is uncommon. Uncommon is not usual. One more interesting rubric that I come across that feels threatened. He felt threatened. That abscess now started threatening him about his concentration, performance, and his looks. And this is where something very interesting rubric, Dr. Jagruti, that feels threatened. And as a result, he is constantly threatening. One more rubric, which it took so little time for me to understand it, but it is applicable in this case. Indifferent. Dr. Jagruti rightly said he is indifferent. But indifferent with what? His exam date must have been declared how long back? What was he doing till now? He said, I did not get time. Now, currently also he does not have time, but even then he's doing it. Then why he didn't do earlier? So what was he doing that? What do we usually say people who starts their work later for the exams? हम क्या बोलते हैं अब तक क्या कर रहे थे? सो रहे थे क्या? Am I right?
Yes, sir.
He said, I started having the boil. 2-3 दिन I did not bother. तो क्या कर रहे थे? सो रहे थे क्या? Phraseologically, I am just applying, if we want to apply to this case, because this rubric I understood much later after studying this case again and again. Indifference, sleepiness with. Very few remedies are there. These two rubrics which I learned, this case we must have presented several times. But even then, every time we knew something different, new. So two rubrics that feels threatened and indifferent, sleepiness with. May not be acceptable, may not be digestible, but think over it. Think talks of, okay. He means business, obviously he means business. He wants to get cured, he wants to get rid of the problem, nothing else. But that is extended version of we want to do. We want to see, does that make a symptom in the case or no? Whatever patient says, should we make it as a rubric? No. Whatever patient says, the description has to help us to derive symptoms, and from symptom we derive rubrics. Or from symptoms we build up totality of symptoms. Then we correlate with materia medica. Okay. So what is the follow-up, Dr. Sneha? Dr. Sneha. Dr. Pankaj, you want to say something?
No, sir.
Sir, what
See-
indifference you said, sir? Indifference to?
Indifference, sleepiness with.
Sleepiness with. Okay.
Can I say something, sir?
Now, such rubrics should not be taken right in the beginning because they are very specific, lately added, and we are applying phraseologically. It is always better to take rubrics which are in general rubrics. So we have to take a general rubrics rather than selecting rubrics which are particular of type, having only few remedies. That will always mislead if we just do that way. Okay. So what else? Somebody was telling something.
Can I say something, sir?
Yes, very quickly, because
Yes,
we are,
yeah, we are already too late, and it will become a very hectic. So I will coming to the point very shortly. Actually, when we look at the case, we have to take the quick judgments, but we should not forget the keynotes in the patient. So when we look through the case, we see the different symptoms like impatience, restlessness, irritability, and chilliness. So all these things are in the combine. We see that these are the keynotes of the arsenic album. So our mind is quickly go to the arsenic album. But when we repertorize, we must have to grade the symptoms. And when we graded the symptoms, we should take care of that. We should not grade it wrongly. Otherwise, it may divert the analysis, and repertorization shows the another remedy. Because when we see the impatience, that in which remedies the impatience is a very in high grade, or we can say is 3 degree or 4 degree. The first remedy we strike in our mind, that is nux vomica, because nux vomica patient is always in the having a much impatience rather than other remedies. But when we look all over the case combinedly, we should consider the totality of the case, and we should find the keynotes or the characteristics, peculiar, uncommon symptoms, which shows the arsenicum album. That's
thank you, Dr. Pramod. Just one point I put here. The last time we had discussed at length about the rubric, in that we had talked about the gradations.
Yes, sir.
That gradations, we have defined what that means. And rather than gradations, what is important that we give focus on the quality of the symptom and the quality of the symptom in the patient as well as in the materia medica.
Yes, sir.
So now let us go to Dr. Sneha if she has to sum up case, or she wants to tell something about the follow-up and what she has learned.
Okay, I'll briefly sum up the follow-up and what I had learned. 1 minute. See, there was no pain, swelling. Swelling was had decreased, and patient could not concentrate on studies. And and he was very thankful to the physician. So that was a change we observed. First time I saw the patient so relaxed. And he was not worried also about the infection. So we had taken that as a central point. So that also was better. So in the follow-up, I could see changes at the physical and at his mental level. And there was no tenderness, objective signs. There was no redness. Size had decreased, and abscess had ruptured and reduced to almost 50% in size. So the learning was that I have to be, the physician has to be empathetic and free from all the prejudice, and how the sound senses helps to see the patient as it is. And the most thing is patients, this has always helped me. When I'm in doubt or when the patient is anxious and all, just record what the patient is saying in his own language without give you the true nature of the disease. And of the true nature of the patient, appropriate rubric. So the exercise you can do in all the cases, which I normally tend to do. And I have this confusion or something, I usually have made it. And from this case, I started making this practice of recording everything in patient's own language. In the beginning, I was clear that this is the abscess I don't have to treat. I have to treat the person behind. What is making him, what is bringing him, how is he behind the abscess? His anxiety, his heedlessness, his impatience, due to which the patient was suffering. So it was not just the abscess, what the abscess, how it bothered him, how he reacted to the abscess, what kind of state it created, that we had to treat. So even I today remember this case and I cannot believe myself and how I could things to and this everything got rounded up in 10 to 15 minutes, and after the patient went, I just couldn't recollect as to what I had done. So how I could control my anxiety, I could not show it to the patient, but the basic fundamentals of homeopathic that gave me strength and the courage to face the situation, which I did not realize during the process. But after solving the case and discussed with sir, I started realizing exactly what I subconsciously applied. So these were my weaknesses versus strength. My weaknesses was that I was a very impatient person. I was very fearful. I was constantly getting number high and only mission of the physician. So I left all my anxiety. I also felt very much frustrated that this patient is not even trusting me. He's doubting my capability of treating him. He's not even considering me as a junior doctor. So all these points were very sensitive. You cannot imagine a person who is constantly threatening you to go in a doctor to go to another doctor. So that is also very sensitive and very hurting. But I left all these things and I just concentrated कि भाई एब्सेंस के पहले के पीछे का इंसान मुझे ठीक करना है, वो क्या चीज है, he is suffering, that he is suffering because of his impatience, his anxiety, his fears. That is what is bringing the patient to the clinic. So I just focus on what it is, what is to be treated, and what exactly I have to see in the case. So that actually gave me the strength to pull through and the implementation of the case taking record. So when after then going back and when I started typing the case and when going this thing discuss, I realized that actually subconsciously I had followed all the processes. Also became aware of myself that I can handle such situations. Now, probably if certain situation comes at this point of time after 14 years, I'll be able to tackle it much better.
Thank you very much, Dr. Sneha, for making yourself available with all the openness, and you came forward to share even your personal feelings for the learning of all of us. And in fact, at some point of time, our own disposition really surface up during our practice, and we need to take care of all these dispositional features at some or other point of time. And we have to also learn that if we can do in our clinical practice, we also require to do the same in our real life. As Hahnemann has rightly said, that physician heal thyself. And then it is possible that I can evolve as a unprejudiced observer. Otherwise, I will not have the sound senses if I am internally disturbed, restless, impatient, or hurt up. We really appreciate Dr. Sneha's efforts. At the same time, today, because of some or other mechanical problem, technical problems, we could not start in time. We really apologize for that. We try to see that we can do in time. And I really appreciate you all for keeping yourself, having the patience, bearing with us, remaining and giving us little more time to share experience. Otherwise, what would have happened that the physician who is coming up to share would have left out with the feeling that has incompleteness about the presentation. So we respected her feelings and her experience, her knowledge, and her efforts. Thank you very much. If you have anything more to say about this case, please write in the chat box, and we'll work out on this. Next time we are going to have a physician who is a very young physician who is practicing at Odisha, Dr. Jitesh Sharma, who has experience of the hospital practice where here Dr. Sneha has come up with the idea how sound senses is required for our development and evolution. Dr. Sharma will present us with through cases the keen observation, how to develop the observation, how observations help us to prescribe, and that too in the hospital IPD practice. So be there, and we meet again after 2 weeks on 25th June, Saturday at 9:30, and we keep ourselves connected through WhatsApp meanwhile, and have a good night. Thank you very much. We see you again. Bye.
Thank you, sir. Thank you, everyone. Thank you, Dr. Sneha.
Thank you. Thank you so much for being patient with me and during my journey and understanding my plight to insight, whatever I went through. Thank you so much.
You presented very well, very
Thank you.
lively. His
Thank you.
experience
Thank
is very lively with you
Thank you.
for so many years. Good. This is a journey of 100 years observer.
Yeah. True. And now while I'm going through my cases and all, also I can reflect that, that how this gives me strength and courage for, facing future patients like this or situations like this.
Okay, so आज हम विराम करेंगे यहीं पे और हम मिलेंगे next to next Saturday after 14 days. Okay, see you all.